Hey, Mr. P here. In this video, we're going to talk about the blood system with a focus or emphasis on atherosclerosis specifically. Atherosclerosis is a problem associated with the kind of health of our blood system or our blood vessels. In previous videos, we've talked about some of the physical adaptations that our blood vessels have in order to allow them to function the way they do. If you haven't seen the video, make sure you do that. But in this video, we're going to kind of dive in and dissect the problem. We're going to talk about why it's a problem. We're going to talk about why it's a significant problem and why you should really take it seriously. We'll also kind of finish out the video talking about some risk factors that will increase your risk of contracting blood system or atherosclerosis. We'll also maybe talk about a little bit of what you can do to help prevent atherosclerosis in the first place. So, what is it? Atherosclerosis is a degenerative disease that causes actual physical damage to arterial walls or our artery walls. A lot of people think that atherosclerosis is a problem based solely on the fact that the plaques are constricting blood flow. And while that is the case, and it is definitely constricting blood flow, one of the most significant problems isn't based on the fact that it is constricting blood flow. It's based on the fact that it is actually physically damaging the inside muscle layer of our artery walls. And we'll talk about that in a minute. Okay? The way that it happens is it's progressive. Okay? So it's going to be kind of a delayed onset. It's going to get worse over time. And it's going to start by allowing cholesterol and other plaques to build up on the inside of our artery walls. Okay? No damage has really happened yet, but it is going to start building up, which, as you can see, constricts blood flow. Now, like I said before, the damage associated with the buildup is the significant problem. Constricting blood flow is definitely not conducive to proper health, and it definitely impacts your ability to move blood. But that alone isn't kind of the issue. As the plaque layer grows, it begins to damage, sometimes substantially, the lining of the artery wall. Okay? What happens as it starts to damage the interior of our artery wall, your body and your immune response actually is going to release what is called macrophages, which is part of your immune response. And it's going to release from the macrophages growth factors that is going to encourage fibrous tissue and cellular growth. Why does it do that? Because it thinks there's a problem, right? When we cut our skin, we have macrophages that release growth factors that allow our skin cells to grow and to repair the tissue. That's what allows us to repair our cut. If you break a bone, you encourage cellular growth to fix the bone. Your body can sense the fact that it has tissue damage. The tissue damage needs to be fixed. The way that it does that, again, is releasing growth factors from these macrophages that encourages this fibrous tissue and encourages growth. But sometimes the plaque ruptures, and it actually allows the plaque to kind of escape where it has been walled off or where it has been growing and has been deposited for several years in a lot of cases. When the plaque ruptures, the body gets or stimulates clotting factors or blood clotting to be triggered. And then, as you guess, when the body stimulates blood clotting, it's going to form a blood clot. And the blood clot is designed to help wall off the rupture, just like as if you were bleeding. The blood clots and it helps to stop the bleeding. The blood clot forms and it actually helps to seal the rupture so that the cholesterol doesn't escape. But when the blood clot forms, that further constricts the blood flow, and these blood clots can actually detach from the wall and the plaque, and then they can travel through the bloodstream and can actually cause a coronary thrombosis, which is a heart attack. Okay? When we look at an in-depth or close-up look of what these arteries look like inside, you will see that there are sections that have normal blood flow, okay, very little plaque buildup on the wall. You can move a lot of blood volume, you can move a lot of red blood cells, normal blood flow. However, in some areas, there are plaques that build up, and that can definitely significantly reduce the blood volume that the body is able to pump. When it does that, you have reduced blood flow, and you can have a backup or a buildup of these red blood cells. And like I said in that previous slide, if this particular plaque were to break, then it would stimulate or trigger blood clotting, which would wall off that break and could totally block this artery, which means blood flow is stopped. And if this was an artery or a vein that was returning blood back to the heart, then heart tissue, which is very oxygen and energy dependent because of the fact that it is constantly contracting, can stimulate very quickly or really quick onset of tissue damage or tissue failure, which can result in heart attack. So, coronary heart disease. Coronary heart disease is definitely tied to high blood pressure. It's tied to atherosclerosis. It's tied to blood clotting. But coronary heart disease is when you have atherosclerosis and blood clotting in the myocardial tissue. So this is actual atherosclerosis in heart tissue. So you have blood vessels that are feeding the heart tissue cells with oxygen, with nutrients, minerals, and stuff like that. Myocardial infarction, okay? Myocardial infarction is the kind of scientific name for heart attack that occurs if a coronary artery becomes completely blocked. Meaning, if this was a coronary artery right here and this particular artery is completely blocked, then all of a sudden, all of the tissue that is downstream of that particular block would start to die. You can kind of see that kind of darker red circle. If that particular tissue starts to die and it goes unoxygenated, then it triggers a heart attack. Occlusion is a condition when plaque buildup is so substantial that the blood vessel can no longer supply even a minimally healthy volume of blood to the tissue. That is in desperate need of repair. A lot of times they'll come in and they'll put stents. They'll basically kind of bore out or open up these particular areas so that it can regain normal blood flow or as close to normal blood flow as possible. Coronary muscle tissue is very oxygen demanding, like I said before. Okay, this particular muscle cell contracts all the time. Remember, it's indefatigable. It is always contracting. Those atria and ventricle muscle cells are constantly contracting, and as a result have a ton of ATP or a very high ATP demand. And if you recall from previous topics, ATP is produced by cell respiration, which requires oxygen as that final electron acceptor. If you kind of have forgotten about cell respiration, go and see those previous videos. But these particular cells require a ton of ATP in order to keep themselves contracting all the time. Okay, this would be an image that is indicative of normal blood flow. Very little, if any, plaque buildup on the interior of walls. All of the blood flow can happen unabated, no blockage. This is what the atherosclerotic plaque buildup would look like. It would substantially reduce the flow of blood. Obviously, it would reduce the volume of blood that's being transported to body tissues. And then if you have a plaque rupture and blood clotting, that forms an occlusion, which remember is a complete stoppage or a complete blockage of blood, which can result and will result in things like heart attack and or stroke. Okay, so what are some risk factors for contracting or increasing your risk of contracting coronary heart disease or atherosclerosis? There is a large genetic component to atherosclerosis and coronary heart disease. It runs in families. Okay, some of you are just more predisposed, even if you are of proper age and of, no smoking. If you're a non-smoker, if you eat well, if you exercise, reduce your stress, you still might have a high risk factor for coronary heart disease just based on genetics alone. So some people have a predisposition for high cholesterol levels and or high blood pressure, which are two things that are associated with coronary heart disease. Age. As your age increases, your arterial elasticity decreases. So elasticity of the artery, remember, is based on those elastic fibers that are kind of embedded and interwoven into the interior longitudinal and circular muscle layers of the blood vessels. And arteries need to be able to be elastic in order to withstand the pressure changes associated with each heartbeat and each heart contraction. As you age, elasticity decreases. If elasticity decreases, then you're going to have more fluctuations in your heart blood pressure. And your blood vessels just kind of wear out over time, just like a lot of other tissues in your body. Gender, males are at a higher risk factor than females. That's just based on gender, nothing else. Smoking, people that smoke cigarettes are going to be at higher risk for contracting coronary heart disease. Smoking restricts blood vessels, and you can imagine that if you're restricting the lumen or the interior diameter of your blood vessel, you're going to increase blood pressure. You're also going to increase heart rate because the blood has to be moved, or the heart has to pump at a quicker rate to move the same amount of volume of blood if the interior lumen of the blood vessels is constricted. Okay, if your heart rate is increased and your blood pressure is elevated, then you're going to be at a higher risk for coronary heart disease, heart attack, and stroke. Okay, there's a decrease in oxygenation of heart muscle tissue, and there's an increase in fibrinogen and platelet concentrations, which are going to increase your ability to clot. So if you smoke, it leads to a constriction of the blood vessels, which is going to increase your heart rate. It's going to decrease oxygenation and oxygen saturation points. It's also going to increase platelet concentration so that you are more able and more easily able to clot blood. All of those things are going to directly increase your risk of contracting coronary heart disease and or increase your likelihood of having a heart attack. Diet, the more fat, cholesterol, or LDL in your blood, the greater the risk of plaque formation in arteries. If your diet is bad, and if your diet has a lot of cholesterol and fat in it, you're going to deposit more plaques. If your diet is better, and you don't eat as much cholesterol, and you have lower fat contents in your diet, you will have not as much plaque to form on the interior of your arteries. Exercise. The more you exercise, the less you are likely, or the least likely you are of contracting coronary heart disease. Okay, the lack of exercise increases your risk of contracting coronary heart disease because it weakens the circulation of your blood. Remember, physical activity and exercise is directly correlated to a strengthening of your blood circulatory system. Obesity or being incredibly overweight is going to increase your blood pressure, and it's going to lead to plaque formation in arteries. And then stress, okay, cortisol levels, cortisol hormones in the blood is going to cause an increase in atherosclerosis because cortisol hormone actually kind of triggers and stimulates plaque to be held onto and cholesterol to be held onto, which is obviously going to deposit more plaque in your arteries. So all of these by themselves are risk factors that can increase your likelihood of contracting coronary heart disease, but a lot of times you have multiple risk factors, right? You might be genetically predisposed to having high blood pressure and also might be an older male who smokes, which, like I said, you have 4 of them. Even if you don't smoke and you're a male that maybe doesn't have the best diet, maybe doesn't exercise as much and has a very stressful job, then you can see you have, 3, 4, 5, 6, maybe even 7 of these at some point. Okay, so the more of these risk factors you have, the more likely it is that you will contract coronary heart disease. The things you can do to minimize the likelihood of contracting coronary heart disease is obviously do the things that you can control. Now, no one can control their genetics. Okay, that's not something that you can do on a daily basis or that you can control because you are ultimately what you are. And you can't change that. Age, you can't change that, right? You're going to continually get older. Nothing you can do about it. Gender, nothing you can really do about that. Smoking and everything below this is in your control. You can choose not to smoke, which will reduce your risk of developing coronary heart disease. You can choose to eat better, which will reduce the risk of developing or contracting coronary heart disease. You can definitely exercise. That's going to reduce your risk. You can, if you exercise and eat well, probably try to eliminate the risk of contracting obesity. which will help to eliminate coronary heart disease. And try to do what you can to eliminate and control stress in your life. That too will help to reduce your risk of contracting coronary heart disease. So focus on what you can focus on. Don't focus on the things you can't focus on, and try to live and lead a healthy life. But that's it. Okay? Bring your questions to class. See ya.